Hello, I'm Dr. Nigel Abraham. I'm the Scientific Director here at Omega Diagnostics and CNSLab. In this short presentation today, I'm going to discuss the clinical utility of food-specific IgG antibody testing, otherwise known as food sensitivity. Now, there is in fact a large body of medical literature that indicates food sensitivity, i.e. high levels of food-specific IgG antibodies may contribute to a wide range of both physical and mental conditions. The evidence strongly suggests that the identification and avoidance of reactive foods can relieve a number of common and often difficult to treat symptoms. Yet, this concept remains controversial. So I'd like to discuss some of the reasons why this is the case. Firstly, it is often stated that the measurements of food antibodies or IgG antibodies is simply a normal response that reflects the diet of an individual. Also, that such measurements cannot diagnose food intolerances or food sensitivities, and that the measurements of such antibodies have no role to play in the diagnosis and management of food allergy. And it's often widely reported that food-specific IgG antibody testing lacks sufficient validation or is backed by research and is therefore not evidence-based medicine. So, firstly, is IgG antibodies to food simply a normal immune response that reflects the diet of the individual? Well, what we do know is that the prevalence of conditions such as migraine, irritable bowel syndrome, inflammatory bowel diseases are continuously increasing. And ecological studies suggest that these diseases are related to adverse food reactions. People who suffer from these conditions could point to something in their diet. And there are numerous studies that have found a link between high levels of such food IgG antibodies and these conditions. For example, this graphic here is showing the relative levels of food IgG antibodies in autoimmune disease. The red column is autoimmune patients, and the orange columns are the levels seen in healthy controls. So we can clearly see at a glance that there is a difference between health and disease here. So IgG-mediated immune responses do indeed play an important role in the pathogenesis of certain adverse food reactions. Another example here is from a paper that was looking at IgG antibody levels in both IBS and also in major depressive disorders. And what we can see here is the red graph is the levels in depressive disorders, the blue graph is that seen in irritable bowel syndrome, and the green is that for healthy controls. So yet again, we have evidence here that it is not simply a normal reaction. And what we're seeing here is an abnormal reaction related to specific conditions and disease types. So whilst it is a normal physiological phenomenon to produce IgG antibodies to all foreign substances, and that can include food, the normal situation is that of tolerance, where our immune system is not actively mounting an immune response. So what about that such measurements cannot diagnose food intolerance? Well, this statement largely comes from the confusion surrounding classification and terminology. Most allergy societies look at the classification of these reactions by trying to divide into two main groups. So adverse food reactions is the umbrella term, and once we get past toxic or non-toxic, we divide into those which do not involve the immune system, non-immune mediated. And these are classically referred to as food intolerance. So we have, for example, pharmacological reactions where we're reacting to something actually in the food. Enzymic reactions, which are classic food intolerances, such as lactose intolerance. There are some chemicals in foods which can act as an irritant, and even psychosomatic reactions where people believe they are reacting. But the important thing here is that this does not involve the immune system. On the immune-mediated side, we have our classical IgE-mediated food allergy. And in most cases, this is mediated by IgE antibodies, but there are also some more complex cellular reactions involved. So where does food IgG antibodies fit into this? Well, of course, they involve the immune system, so they are on the allergy side. And they are a type of hypersensitivity. And the generation of IgG levels is often referred to as food sensitivity. But this is where some of the confusion comes in, because in common terminology, these type of reactions are often referred to as a food intolerance. Now, as we have defined it here, that they are not technically an intolerance, but sometimes they are referred to as an allergy because they are actually a form of allergy. But using the term allergy can be problematic. We do not want to mix up IgE reactions and IgG reactions, which is often the case. As we've said, they are a form of hypersensitivity. So Joe and Coombs identified 4 specific types of hypersensitivity. Type 1 is our IgE-mediated classical allergies, and type 4 is certain types of T-cell mediated allergies. What we're interested here is type 3 IgG-mediated sensitivity, which informs the formation of immune complexes. So IgG testing has no role to play in the diagnosis and management of food allergy. This is partly because of the confusion surrounding terminology, but it is also related to the measurement of IgG itself. Now, there are 4 subtypes of IgG, and they do have very different properties. IgG1 and IgG3, which are the predominant antibody IgG subclasses that make up most of our IgG response, are pro-inflammatory. They will trigger the inflammatory pathways and therefore can lead to symptoms associated with food sensitivity. If we contrast that with IgG4, we find completely the opposite. IgG4 is a unique molecule. It has protective and anti-inflammatory properties. And in fact, a relatively high percentage of people, 10 to 15% of healthy people, don't actually even have an IgG4 response. Now, this has significance when it comes to testing. Now, IgG4 has shown that it is essentially a blocking agent, particularly against our IgE allergic reactions. It is, in fact, nature's way of trying to protect us from what would be otherwise very damaging immune responses. So it is all involved of our type 1 classical allergy and not food sensitivity. It doesn't activate complement, so it can't trigger the inflammatory pathways leading to symptoms of food sensitivity, and it doesn't activate inflammation in the way that IgG1 and IgG3 does. So basically, IgG4 has no involvement in our type 3 food sensitivity mediated by IgG antibodies. So when it comes to testing, it's very important that the test that you choose is measuring total IgG and not IgG4. So why do these statements saying about the validity of IgG occur? Well, one of the examples is outdated and inaccurate statements. Now, this is the World Allergy Organization statement made in 2020, and it talks about food allergy in all of its forms. We can see, for example, that food allergy actually only affects a very small percentage of people. But it points out that the public perception of food allergy and intolerance is much higher. Essentially, what it is saying is that people believe they suffer from the food reactions more than we can show through traditional allergy testing. And it says that this perception is at least part based on unproven diagnostic approaches, and that therefore the use of unreliable diagnostic approaches may be costly to patients, delaying appropriate diagnosis and therapy. So when we look into these guidelines, we find that one of those unproven techniques is the measurement of our IgG antibodies. And as we can see here, it is talking about the use of IgG in the diagnosis and management of allergy. And it is talking extensively about IgG4. And we have already pointed out that IgG4 is a very different type of measurement involving a very different molecule. But to make this statement, there are 3 references quoted. So let's have a look at those references a little bit closely. We find that the first 2 are very old references dating back to 1987, and they are looking specifically at cow's milk protein intolerances or reactions. At that time, reactions to cow's milk proteins were not fully understood, and a lot of them are cellular mediated types of allergy and do not involve an IgG response. So both of these references have no relevance to the statement that IgG testing has no clinical utility. And the third reference, as we can see, is specifically talking about the role of IgG4 measurements in the evaluation of allergy. So again, it is not relevant when we are talking about food sensitivity. Lacks sufficient validation or backed by research and is therefore not evidence-based medicine. This statement comes from the fact that most reviews which make these statements have simply not reviewed the current evidence. There is a wealth of published evidence to back up the clinical utility of IgG testing. So I just picked out a couple of papers that I believe can make that point. So obviously, this was a review or a paper that looked at comparing an IgG-guided diet and a FODMAP diet in the treatment of IBS. Now, I've picked this one because a low FODMAP diet is a validated and recommended approach to treating IBS. So what this group showed was a matched group of patients who were given a low FODMAP diet, another group of patients who were given an IgG-based elimination diet, and these were compared to a control group, which was just a standard diet given by a gastroenterologist. And what they found was stark differences between the efficacy of these 3 approaches. Now, for the IgG-guided approach, all IBS symptoms, as well as other symptoms such as headache, skin reactions, and general lethargy, all showed a statistically improved appearance or disappearance, in some cases disappearing completely, in this IgG-guided group. Contrast that with the low FODMAP group. Here we found that only symptoms of bloating and gastric fullness showed any significant improvement, and not surprisingly, the control group with the random diet actually showed no improvements at all. So the conclusion from this group was that the most effective diet in the treatment of patients with mixed IBS was the elimination or rotation diet based on our IgG antibody testing. So here we have evidence that the IgG sensitivity approach is a far more useful and more clinically relevant test than using a low FODMAP dietary approach. And this other paper was looking at the role IgG-guided diets may play in inflammatory bowel diseases, specifically ulcerative colitis. Now, these are often severe conditions that rely predominantly on medications to control the disease. But it may be that dietary interventions can reduce the need for such pharmacologicals and help to prolong remission. So this group set out to evaluate this by using IgG-guided exclusion diets. But I've picked this paper because it actually showed histological evidence to back this approach. For example, this is a highly ulcerated and inflamed bowel from one of the patients before they went on an exclusion diet. This is the same bowel in a patient following an IgG exclusion diet, showing significantly reduced inflammation and alteration. So the group went on to say that sticking to an IgG-based diet can effectively improve symptoms and the overall quality of life in these difficult and challenging conditions. And in the future, such dietary interventions should play an increasingly important role in the management of ulcerative colitis, acting as a viable option to reduce symptoms, shorten the course of disease, and speed up recovery, the goal which you are looking for in any treatment option. So an IgG-based exclusion diet may ultimately reduce the economic burden of this condition to the healthcare system. So in conclusion, much of the confusion surrounding the efficacy of food reaction testing and non-IgE tests in particular has arisen from the rather indiscriminate use of terms such as food allergy, food intolerance, and food sensitivity, without clearly defining what we are talking about. Use of the term food allergy to describe IgG food reactions has created the impression that functional and integrative medicine physicians are equating IgE food allergies with IgG food reactions, and this is simply not the case. This has led to the often widespread opinion to dismiss IgG because it lacks clinical utility, essentially because it doesn't agree with IgE tests. But as I hope we've shown today, it doesn't, because it is not used for that. Food sensitivity is a discrete entity and is not about IgE allergy testing at all. Unfortunately, this runs a very real risk of ignoring the relevance of IgG food reactions as a separate clinical condition. It discounts the significant progress that can be achieved through properly designed elimination diets using IgG testing in often very challenging health conditions. So the appropriate use of food sensitivity testing can help guide clinical decision-making that takes into account the totality of the patient's clinical picture, as well as addressing the underlying causes of many of their presenting health challenges. Thank you for watching.